One of the most common questions I get asked has to do with supplements. I get a lot of patients that ask me, Dr. Sylvester, what are the most important supplements that I should be taking to optimize my health and to reduce my risk of disease? And the supplement that I find myself, one of the supplements I find myself most commonly recommending to my patients is vitamin D. And the reason for that is because vitamin D deficiency here in Canada is rampant. There was a study done by Statistics Canada that found that 60 to 70% of Canadians are vitamin D deficient. And the reason for that is simply because of our geography. We live in a place where we don't get sun exposure 12 months of the year. It's only 3 or 4 months where we're outside and our skin is exposed to the sun, which is how your body makes vitamin D. So the fact that we're deficient in vitamin D sets us up for a whole host of different health challenges. Vitamin D influences about 3,000 of the genes in your body. So when you're deficient in vitamin D, it sets you up for health problems like osteoporosis, like decreased immunity. You're more vulnerable to colds and flus and infections. Vitamin D influences your body's ability to fight and kill cancer cells. There's actually been studies done that show that you're at increased risk for breast, colon, and prostate cancer if you're deficient in vitamin D. Even things like heart disease and stroke and type 2 diabetes, autoimmune diseases like multiple sclerosis, depression, seasonal affective disorders, mood disorders, inflammatory conditions like psoriatic or rheumatoid arthritis. There's so many different conditions that are related to vitamin D deficiency that it's so important that you make sure that your vitamin D levels are optimized, not just on average, but at an optimal level. And the only way to know if you need to take vitamin D and how much to take is to have your vitamin D levels tested. In our office, we have some very simple kits. They're called D-Spot vitamin D test collection kits that we send our patients home with. They take a simple pinprick and send a sample off to the lab, and 2 weeks later we get a report back that tells us what their vitamin D status is. And to optimize your health, your number needs to be in the 40 to 60 nanogram per milliliter range when we do that test. That's the optimal range. And if you're below that, if you're deficient like most Canadians are, you need to get on a good vitamin D supplement in the months where you're not exposed to the sun. We recommend vitamin D3 with K2 because vitamin K2 makes sure that calcium goes to the right places in your body, to your bones and your teeth, and away from your arteries and your soft tissues where you don't want it. How much should you take? That's the other question. Researchers agree that you should roughly take 35 international units per pound of body weight. That means if you weigh 100 pounds, you should take about 3,500 international units. If you're 175 pounds like I am, you should be taking about 6,000 international units. And many of the patients that I see that are supplementing are taking far too little to get their vitamin D levels into an optimum range. So I would recommend getting your blood tested, and if you're deficient, supplement for a couple of months and then retest it to make sure that you're in the optimal range. Once you move into the summer months and you're being exposed to the sun, you don't have to take the supplement anymore. Your body can make it on its own. Just make sure that you're getting some healthy sun exposure as you go through the summer. And I would define that as getting out in the sunshine 2 or 3 times a week and exposing yourself for 15-20 minutes to as much of your bare skin as possible, your arms, your legs, your abdomen, your back, because the more exposure you have, the more vitamin D you're going to create. And obviously we don't want to get a sunburn, but we want to get healthy sun exposure to make vitamin D. Really important step for you to optimize your health, for you to lower your risk of disease, making sure that you have optimal vitamin D status. If you have any questions about this, please feel free to respond to this. Check out our website, gracechiropractic.ca. If you got any questions, comment, I'll make sure that we get back and answer any questions that you have. I'm Dr. Tim Sylvester. I hope you have an amazing day. Bye for now.